We have 6 new cases in Queensland. 2 of those are overseas acquired and in hotel quarantine. 4 are locally acquired in the community. However, one of those, we're still checking whether this is a historic case. In relation to the other 3, the Premier did highlight these this morning. One gentleman who works at the Training Aviation Centre and another household contact has tested positive. We are putting up exposure sites, so we put exposure sites up in relation to that individual last night, but please keep checking the Queensland COVID website for any new exposure sites as we talk to the 2 household members and get more details about where they have been over the last few days. That individual has been infectious since the 23rd of September in the community, and then we have an individual who I understand works as a truck driver who has been infected since the 19th of September. I'll get the Chief Health Officer to go through these in more detail. Importantly, what does that mean as far as restrictions? What we are asking is that Brisbane City Council, Moreton Bay Regional Council, we are putting back in place immediately the mask restrictions for those 2 councils or for anyone who has been working or in those areas since the 19th of September who might live outside of those areas. So if you work in the city but you live outside of the Brisbane City Council, Moreton Bay Regional Council area, we ask you also to abide by these restrictions, which is wearing your mask at all times, indoor and outdoors, unless you are outdoors and can socially distance. This will be in place for 2 weeks while we work through the risks of these cases, and it also means in those 2 local government areas that we will be restricting access to vulnerable facilities again. So hospitals, aged care, disability facilities in those 2 LGAs will have restrictions immediately. This is obviously to protect the most vulnerable in our community. We have reached out to private pathology providers and requested in the Moreton Bay and Brisbane City Council areas to allow people to come in to get tested without appointments. So we will update on our website if we get confirmation, but I know that our private pathologists have done an amazing job throughout the pandemic in working with us whenever we do have community cases. So we do ask, if you have any symptoms whatsoever, please come and get tested straight away and isolate until you get your results. And of course, if you've been to any of those exposure sites, contacting Queensland Health and following the advice that you have been given. I also want to reiterate to everyone, vaccinations is the key. Don't wait until we have broad transmission of the virus through our communities. Now is the time to come out and get vaccinated, and we want people getting vaccinated as quickly as possible. We have now Moderna being offered in our community pharmacies. We have Pfizer being offered at our GPs and medical centres, as well as at the Queensland Health Run community vaccination hubs. So, and there's AstraZeneca, of course, also at all of those sites. So there is plenty of options. There is no reason not to be getting vaccinated now. If you are 12 or older, come forward and get vaccinated as soon as possible. And I can announce that Boondall Vaccination Centre will accept walk-ins, full walk-ins, bookings not required at all from today. And it has lots of capacity, so we do encourage people, not just from the north side, but if you're looking for somewhere to get vaccinated and you're finding the other smaller hubs are really busy, come to Boondall and get vaccinated as well. The last thing before I hand over to the Chief Health Officer is the Deputy Commissioner will also update us on a very sad incident that's happened in hotel quarantine, and I'll let the Acting Deputy Commissioner speak to that. So please, we know that this virus is on our doorstep. Don't wait, go get vaccinated, and please come out and get tested if you have any symptoms whatsoever, whether you are vaccinated or not. If you have symptoms, please come forward and get tested. We do this, then we can get through this again without having to go to further restrictions. But this is a time where we need to watch very closely and, of course, the hours and the next couple of days will be crucial in people coming forward and getting tested. Thank you.